Ask the Expert series. Today's topic is obesity care treatments, not a one-size-fits-all approach. I'm your host, Susan Weiner. I'm a registered dietitian, nutritionist, and certified diabetes care and education specialist. Our Ask the Expert series is all about you and your questions and what you'd like to know about this important topic, obesity care treatments. So we invite you to get your questions ready. Please stay with us throughout the hour and you'll learn so much and so many useful tips to help you live well with your journey with diabetes. And in addition, at the very end, we have a very short survey that we'd love your participation in. Your feedback is essential for us planning future events. So please stay tuned throughout the entire event. If you're joining today and would like to ask a question about this important topic, please press *3. That's *3 on your keypad, and an operator will collect your question and place you in a queue. So you will have the opportunity to ask it live if you'd like to during today's event. If you're participating online, please type your name and question in the fields below the streaming player. And remember to hit the submit question button, and your questions will come directly to us. And I will be glad to ask it live during today's event. By joining our program today, you're taking a great step towards taking care of your health. A special thank you to Lily for supporting and sponsoring today's Ask the Experts event, as well as the work of the American Diabetes Association to address obesity. Obesity results from a mixture of environmental, behavioral, and genetic factors. This means there are multiple ways to manage it. If you'd like to learn more, please visit diabetes.org/obesity. I am excited and super delighted to introduce tonight's guest expert, Dr. Donna Ryan. Dr. Ryan is a professor emerita at Pennington Biomedical in Baton Rouge, Louisiana, where she has had a 25-year career in clinical research in obesity. She was an investigator on Pounds Lost, Look Ahead, DPP-DASH, and so many other studies of the health benefits of weight loss by diet, lifestyle intervention, and medications. She was the PI on a series of studies for over 25 years, funded by the U.S. Department of Defense targeting military nutrition. Her personal research studied improving primary care management of obesity, and she's been an active member and former president of the Obesity Society of North America and World Obesity Federation. She has more than 300 publications and is a frequent speaker on obesity and diabetes treatments, and remains an active consultant and advisor to companies developing medications, devices, lifestyle programs, and medical approaches to obesity management. Thank you so much for joining us, Dr. Ryan. We're thrilled to have you here.
Well, I am thrilled to be here. Thank you for having me, Susan.
Of course. And Dr. Ryan, diabetes management and weight management treatment plans must be individualized because they vary from person to person and they change over time. So just to kick off tonight's discussion, what should a person who is living with type 2 diabetes consider when exploring treatment options for weight and obesity management?
Thanks, Susan. You know, that relationship between obesity, our body weight, and glycemia is very, very tight. And we know that if we gain weight, we can make our glycemia worse and make our diabetes worse. And sometimes just a little bit of weight loss can really improve glycemia. So, patients with diabetes they come in many varieties. And so we don't want to have a one-size-fits-all approach to weight loss. I think the first thing to consider if you're a patient with diabetes and you're thinking about weight loss, I think the first thing to consider is, what is your goal? Why do you want to lose weight? Is it because you want better glycemic control? Would you like to see your A1C lower, your fasting glucose lower, better numbers on your CGM device? What is it that you want to achieve? There are many things can improve with weight loss, but sometimes it takes more intensity of effort than than other times. So the first step is to try to figure out what it is you're trying to achieve with weight loss. I think there's nothing wrong with feeling better about yourself. And sometimes when we lose weight, we feel a lot better about ourselves. Sometimes we can more functional. We can get down on the floor, get up from the floor more easily. Sometimes we can lower our medicines for lipids or even blood pressure if we can get enough weight loss. So there are many, many reasons to be thinking about weight loss. And I think we really need to tailor the weight loss approach to the patient. You said it so well when you talked about personalizing the approach to weight loss.
It's so individualized, and thank you for that excellent kickoff response. It's so individualized and it changes over time, the same way that diabetes management changes over time, not only because we age, but because of circumstance. Can you speak a little bit about that?
Yeah, absolutely. I think age is a big factor. For older individuals, we're always a little careful about weight loss because, as you age, the body normally is losing lean mass. It's losing muscle mass and bone mass with aging. Your peak muscle mass is at age 30, but it really tends to accelerate. That loss of muscle mass accelerates really in the 60s. And so what we frequently see is individuals stop gaining weight, their weight loss plateaus, and they may even lose some weight. They stop gaining, they hit a plateau, and they tend to lose weight the older they are. And so we're always careful about being too aggressive with weight loss in older individuals because when we lose weight, you absolutely will lose both lean mass and fat mass. The bad part of it is the fat mass. And so we want to, especially in older individuals, limit as much lean loss as possible. So that's one
Yeah.
example. Yeah. What else do you think?
No, I think that that's excellent and a discussion that we need to talk about because of when we lose weight, people look sometimes at only scale weight, right? So they look
Exactly.
at what the
Exactly.
pounds are on the scale, but not lean body mass versus fat body mass.
Yeah. 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 Exactly.
I think that's absolutely correct and a very important issue. So, as a reminder, tonight's discussion is on obesity care treatments, not a one size fits all approach. And as a reminder, for those of you who are joining on the phone, please press *3, that's *3 on your keypad, and we will collect your questions and put you in a queue so you can ask your questions live. And if you're participating online, please type in your name and question into the fields below the streaming player and hit the submit question button so your questions can come directly to us. And I promise that we will try to address as many questions as possible. And before I go to some of the questions that are coming in, Dr. Ryan, I just want to continue on the point a little bit about lean body mass and fat body mass
Yeah.
and scale weight. Can you please elaborate on that? I find it so interesting because when we have these discussions, people who are living with diabetes will be their healthcare provider may say, I want you to think about losing some weight. And that can be interpreted as losing just pounds on the scale, which can be lean body mass.
That's right. Absolutely. I think what the bad body fat is the fat that's located in organs and in the visceral compartment around the waist. So what we really want when we lose weight is to lose the bad fat. Look, all fat is not bad fat. It is sometimes healthy to have subcutaneous stores of fat, especially in the hips and thighs. That's not bad for you. It's the fat that's within the abdominal cavity, and it's fat that's around the heart, that's in the pancreas, that's in the liver, and that's located inside of the abdomen, sometimes on the kidneys. And so that ectopic fat and that visceral fat is what we're trying to reduce when we try to when we help people lose weight to manage their health. So that's the most important thing for people to understand. That it's not really we're not really trying to get everybody down to some sort of ideal weight. we can
Mhm.
achieve a lot of health benefits with more modest levels of weight loss. And the reason for this is when you lose weight, the bad fat is the first to go. So that's a very, very good thing. And that's why, especially in diabetes, if you have prediabetes, we know that if we can get just 10% weight loss, we can I can virtually guarantee that we can prevent progression to type 2 diabetes. So it's that tight relationship between glycemia and weight loss and the removal of body fat from within the visceral and ectopic depots that makes that wonderful thing happen. But there are other benefits of weight loss that actually take more weight loss. It takes more than 10% weight loss to really improve symptoms of obstructive sleep apnea. It takes more than 10% weight loss to improve symptoms of GERD, gastroesophageal reflux disease. So sometimes, and also we think to prevent heart attack and stroke, we should be aiming for more weight loss, more than 10% weight loss. So, modest weight loss can give us some great health benefits. And sometimes we don't really want to be too aggressive in our weight loss. You know, um, One thing about obesity, it is weight bearing exercise. And so individuals with obesity, younger individuals, tend to have higher muscle mass. And when they lose weight, you're carrying fewer pounds. And so, of course, you're going to lose some lean mass along with the fat mass. We like it to be about 20 to 25% lean loss for 75 to 80% fat loss. That's what we like to see. And the way we go about trying to preserve as much lean loss as possible is to have people make sure they're getting enough protein in the diet and to make sure they're doing weight bearing exercise. So we like to see people moving. If we have a more aggressive weight loss approach, I really tend to push people towards doing resistance training to
Mhm.
try to build muscle while you're losing weight.
It's such an excellent and important and under discussed
Yeah.
suggestion to do the weight bearing exercise. It's so important.
Yeah.
Dr. Ryan, we have a couple of questions that are coming in, and I'm going to go to some of the questions that are coming in online because I'm seeing a number of
Good.
great topics come in. One is coming in from Mike, and Mike asks, how can bariatric surgery be considered along with medications and diet and exercise? So I guess a little bit of an explanation about what bariatric surgery is and how effective that can be for people living with diabetes, along with medication, proper nutrition, and physical activity.
We have a lot of good evidence supporting the use of bariatric surgery in patients with type 2 diabetes. So we know that we can get some real health benefits with these approaches. The most common surgical procedure done in the United States today is the gastric sleeve. And what this is the stomach is removed on its greater curvature, and you're left with a small remnant of the stomach. The second most common procedure is the Roux-en-Y gastric bypass. And in this procedure, the gut is rerouted, and so the pouch that's left in the stomach is very small. It's about the size of I guess say a small lemon, and so food there's individuals initially cannot eat very large meals, but the food is directed into the small intestine, and so it's bypassing the duodenum. And what this does is it has an effect on gut hormones to promote satiety. So those are the two most common procedures, and we've had them around for a long time. One thing that our surgeons have done, and we really need to give them credit for this, is they've established centers of excellence. And so all of our surgeons are trained in fellowship programs. They pass a board exam. They and the surgeons give really excellent care. They have a team approach, a multidisciplinary team approach to the bariatric surgery. The average weight loss with the gastric sleeve is about 25% from baseline. Patients generally lose weight for slightly more than a year. The average weight loss with the Roux-en-Y gastric bypass is about 35% of your weight is lost from where you started. And that continues also for about 18 months. Now, one of the things that's good about our current approach to that the surgeons have put in place with these centers of excellence is a wraparound care approach. So patients are they meet with a psychologist before they undergo surgery. They meet with a nutritionist. They are given lots of information and advice and training in what to eat after surgery. And almost all patients are put into a program where they are walking, where they are doing some resistance training, and all of that is good. You know, these the good thing about the bariatric surgery procedures is they produce robust weight loss, and it tends to be durable. There are some patients will not achieve those average results that I talked about. And some patients will also regain. That's the minority. It's about 25% of patients will not have those ideal results with bariatric surgery, and they will require more medical approaches. But the good thing about bariatric surgery is the durable nature of the weight loss. But it comes with a caution, and patients who have this procedure require nutritional support for the rest of their lives. So when part of the stomach is removed, it alters your absorption of vitamins and minerals. And when that rerouting occurs, the same thing occurs. So we have to be very careful about iron deficiency, about calcium deficiency, and vitamin D deficiency. Patients need to be on vitamins and they need nutritional support really for the rest of their lives. But this procedure can be life saving. We know that individuals who have bariatric surgery compared to matched controls have reduced mortality, they have fewer heart attacks, they have fewer cases of cancer. So it can be in the right patient, it can be a very, very wise choice to undergo that. And that's especially true for individuals with type 2 diabetes because after bariatric surgery, there's generally much better control of glycemia. Susan, do you have any questions about that?
I do, and there are a bunch of questions coming in too, but I was just fascinated with your response to that and some of the discussion that's coming in as well. And it is extremely, I think part of the takeaway of that is the surgery is a tool, going back to what Mike's question is, along with the nutrition and the physical exercise, and not just the aerobic exercise, but the resistance and strength training exercise to make sure we're preserving and or building that lean body mass. And to your point, Dr. Ryan, which is an excellent one, sometimes the malabsorption in particular of iron and calcium can affect a lot of individuals. So that's why it's very important to not only have those pre-operative visits with your dietitian, but post-operative and staying with them. Yes.
Post-op too, Susan.
Yes, very, very important. We have a live question also that's coming in from Shirley. Shirley, if you'd like to go ahead and ask your question to Dr. Ryan, we'd love to hear it.
Okay, hello. My question I know is kind of against whatever it is, not against, but different from what this topic is about. Yeah. My issue is that in November, I became the caregiver for my mother and my brother, and that was different for me. And my blood sugar started going up, up, up. And so to get it down, the endocrinologist put me on Rybelsus. And I was already on metformin and Jardiance and glipizide. Took me off the glipizide and did the Rybelsus. Okay, that caused big, big, big weight loss. I was about 130 pounds, and now I'm about 103 pounds. I look sick. People think I'm sick, and I don't. I just really would like to get that weight back. After my blood sugar did come down significantly, I was taken off the Rybelsus, but I'm still on the Jardiance, now back to glipizide and metformin. Well, I just like to get back that.
Yeah.
weight
So
I
that
had.
that Rybelsus that you took it's
Mm-hmm.
called a GLP-1 receptor agonist, or a GLP-1 RA. And that medicine, it
Mm-hmm.
has a lot of effects. One of the things it does is very powerful in reducing blood sugar. So if
Yes,
your glycemia were out of control, it would help that. But it also
it
has an
did.
effect on appetite. Yeah, and the appetite
Mm-hmm.
effects can be profound. And so
Mm-hmm.
you can lose weight. And it sounds like you lost weight down to a very low BMI. You know, as physicians, we know that this action of improving glycemia and causing weight loss, they're
Mm-hmm.
independent effects of the drug. So we don't want patients
Okay.
losing too much weight on these drugs. And so your
Mm-hmm.
doctor was wise to stop it. Yeah.
Mm-hmm.
So generally, when you're off the drug, your weight regain will occur. You need to be careful though, and make
Okay.
sure that you're doing your physical activity, because what you don't
Yes.
want to do is gain back fat. You want to gain back some
Yeah.
lean with that. And if you
Yes.
just unless you're doing some resistance training, you can get some bands and do that at home,
Mm-hmm.
or doing some weight
Mm-hmm.
bearing exercise, walking. That will happen.
Mm-hmm.
You know,
Yeah, I'm
I
still
think
exercising.
as we get older, we become caregivers for our parents and sometimes our
Mm-hmm.
siblings. But you also have to be
Mm-hmm.
your own caregiver.
Great
You must
advice.
take care
Yeah.
of yourself.
Yes.
Yeah.
That is great
Mm-hmm.
advice.
Exactly.
Shirley, thank you
Yeah.
so much. That was such an excellent question and call. We appreciate you. Thank you very
Thank you
much.
much. Mm-hmm. Thank you too.
Yeah.
Dr. Ryan, we have another question that's coming in online, and this one's from Anna. This is a great question. And Anna asks, how do we measure lean versus fat body mass? Is this something we can do at
Mhm.
home?
Mhm. Well, that's a great question. You know, we have different tools that we use in the clinic, and especially in research. When we're researching this, we'll do a DEXA scan, which is the same scan you're probably getting for your bone density. You know, as women age, we get sent for these DEXA scans to see if we're having signs of osteopenia or osteoporosis. Well, you can determine your percent body fat and the fat-free mass. It's a little bit more than lean mass. It's lean mass plus. It's called fat-free mass and fat mass with a different program on that DEXA. So that may be available to you. But you can also, there's a program that people can get called Me 360. And what this does is you take a picture of yourself on your phone, on your mobile phone, in the bathroom, in your gym clothes, please, tight fitting gym clothes. And you take 4 pictures, and it has to be from head at least to the knees. And you take a front, both sides, and a back. And then you enter your weight. You get on the scale at the very same time and you enter your weight. And so what that scan does is you know your volume and you know the weight. And from that, we can predict fat mass. So that's one way that people can do that. This is called digital anthropometry, and it's something that's out there on the internet if you have a mobile phone. Yeah.
That is so interesting. That's fantastic
Yeah.
information. Really great. We have another question that's coming in online. We have a few of them. This is a great one from Jean. And Jean asks, how does celiac disease relate or help in weight loss with type 2 diabetes? And are they all related? And I would expand on that question with autoimmune diseases in general, because we get that question a lot here,
Yeah.
Dr. Ryan, from our listeners who may have
Yeah.
type 2 diabetes and autoimmune diseases as well.
Yeah. 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 Yes, these autoimmune diseases that involve the gut can be associated with weight loss, but it's generally not a healthy kind of weight loss because you're losing essential nutrients. You're failing to absorb those essential nutrients. So we really watch that very carefully. So I'm going to flip this over to my favorite registered dietitian. That's you, Susan. And what sort of counseling do we give to patients with celiac disease? Yeah. I think the
So
most important is to be under good medical care and managing those celiac symptoms. But what about diet?
absolutely. And it's a great point. And as we will hear Dr. Ryan saying, it's important to consult with your registered dietitian and many members of the healthcare team, because you, as the person living with diabetes, are the center of the care. And we all have to collaborate together to get to a better place and to embrace more positive health outcomes. So if a person truly does have celiac disease, we we limit the amount of gluten, go to a gluten-free eating plan, and we do that with speaking with you and with your family members or whoever is doing the food shopping and the cooking, so that we can really understand what you're currently eating, what you can eat, budget concerns, preferences, cultural concerns, so that we can build an individualized meal plan that is gluten-free, friendly for your blood sugar. We may have to consider weight management, whether it's like our previous caller who talked about being at too low a weight or having to lose weight. So we look at this all together. I never assume anything when I speak to a person who is coming to me for nutritional guidance or professional guidance. I always sit back and say, please tell me what you're currently doing, and never give a pre-printed copy of anything. That's how I work.
Yeah. Yeah. I love
Never
that.
provide a pre-printed copy of anything. Yes. Absolutely. And as a reminder, for those of you who are joining us today by phone, if you have a question, please remember to press *3. That's *3 on your keypad, and we'll take your questions and place you in a queue so that you'll have the opportunity to ask them live. And if you're participating online, please type your name and question into the fields below the streaming player. Remember to hit the submit question button so that we can ask your question for today's event. Okay, let's go to another question. As Dr. Ryan, as everybody is hearing, has these phenomenal responses, and we really appreciate it. Jan is asking a question that several other people are also asking online, which is to please address insulin resistance. Why do I
Yeah.
go to bed at 69 on my glucose monitor and wake up registering in the 200s? Why can't I eat just one meal a day to lose weight? Those are two different questions. So let me repeat the first part of it first.
Yeah, please.
Please address, right? Those are two very different questions. Please address insulin resistance. Why do I go to bed low and then I wake up high with my blood sugar?
So insulin resistance it's the underlying pathology in type 2 diabetes. And what it means is that your body's cells are not they're not sensitive to the effects of insulin. And what tends to happen over time is that your beta cells, the cells that produce insulin, they get tired, they wear out, and so over time you have less insulin reserve. At the beginning, you can have very high insulin levels, but when your blood sugar starts to rise, that means that your beta cells cannot keep up by producing more insulin to overcome that resistance. So the reason that you go to bed with 69 and you wake up with a blood sugar of 200 is that your beta cells are not able to produce enough insulin to keep that blood sugar down. You have a defect in insulin production that was initially caused by resistance to the insulin levels.
That's a very important discussion that we have about that. And also, I would say, please don't always focus on one number of your
Exactly.
glucose meter, right? That's important. And
Yeah.
before I go to the next live question, we have more live questions coming in. I would love to hear your perspective on that, Dr. Ryan, and how people just feel not only about their number on the scale with their weight, but they feel affected by blood glucose levels. It kind of makes them feel like a bad person sometimes. And people who are
Oh, yeah.
listening today do make that comment often.
Yeah. I think that, the most important thing is how you feel and how you function. And the numbers are just numbers. So, absolutely. We have trigger numbers where we want our, whenever possible, we want people to over time have an A1C, say, of 7 or less.
Mhm.
But I think we understand that throughout the day, and we've learned this with our continuous glucose monitors, that some foods will trigger a high glucose spike, and it's very difficult. It's impossible, really, not to have variation across the day. So I think we have to remain calm, and it's not one number. One swallow doesn't make a summer, and one number doesn't make you a bad patient.
I love that. It was awesome.
Yeah.
Okay, let's go to another live call. This one comes from Alice. Alice is calling from Monterey Park, California. Alice, please go ahead with your question.
I would like to know, how do you get rid of visceral fat? Is it diet? Is it exercise?
You lose weight. This is one of the most wonderful things about the human body. The bad fat is the first to go. So we can lose, when you lose just a little weight, you lose a larger amount of visceral fat proportionally. So, for example, when you lose just 10% of your body weight, you will reduce 20% or more of your visceral fat. So it's the bad fat that's the first to go. And that's why we don't need to make everybody skinny. We can get a lot of health benefits with just 10% weight loss, with just 15% weight loss. Patients may still qualify as having a BMI that we call overweight or a BMI that we call obesity. But at that reduced level, they've lost enough visceral fat to really improve their metabolic health.
Thank you very much.
You're very welcome,
Yeah.
Alice. Thank you so much for the question. We appreciate it.
Yeah.
We have another question that's coming in online that I find very interesting in terms of fat loss. Jody is asking, so what about liposuction? If somebody got liposuction, does that also, what kind of fat is that reducing? And does that help in the management of type 2 diabetes?
Bravo. Thank you for giving me this question because everybody needs to hear this. Liposuction does not improve your metabolic health. No, that's the subcutaneous fat, the fat that's under the skin that's being removed. And there's a wonderful study done by Dr. Sam Klein, and he did large volume liposuction. He took patients who had a lot of fat around their abdomen, but under the skin. It wasn't within the abdomen. That visceral fat is within the abdomen, inside the abdominal, the abdomen itself, inside those muscles, in the abdominal cavity. And he did large volume liposuction. And he had some patients who had diabetes, some patients who had prediabetes. Everybody had overweight, but there was no change in hemoglobin A1C. There was no change in insulin sensitivity with that liposuction. It didn't improve any of the metabolic markers. So yeah, liposuction can remove that subcutaneous fat, but it's not that fat is not unhealthy. The unhealthy fat is within the abdomen and it's around the organs. Yep.
I've also seen in my practice for people who have had, I don't have too many patients with it, but people who have had a liposuction procedure regained weight and the fat shows
Yeah.
up somewhere else. What is that about?
Well, when you do the liposuction, you interrupt the scaffolding of the fat tissue itself. And so, yes, I've had individuals who've reported that to me too. I don't think that's been studied systematically. I don't know of any scientific studies about that. But yeah, the problem with weight gain is we all have a certain ability to store subcutaneous fat. And for women, it's in the hips and thighs, right? And that fat is not bad for us. That's good fat. And in fact, some studies show that it's protective. It's protective of our metabolic health and our cardiovascular health. So, so it's when we gain weight, when we exceed our ability to store fat subcutaneously, we will start storing it viscerally, within the abdomen, in the omentum, around the kidneys, in the pancreas, in the liver, around the heart, around the blood vessels, on the kidneys, and all of that is ectopic fat, and that's the bad fat. And to get rid of that fat, we have to do weight loss. And as I said, the good news is that we don't need to make people skinny because we get more. The last bad fat in is the first bad fat out. So we lose it disproportionately when we lose weight, and that's a good thing. That's why if we can just get 10%, 15% weight loss, we can really get a lot of health improvement because we're reducing ectopic and visceral fat disproportionately.
Very well said. I have to go back to the second part of Jan's question before I go forward because I forgot to address this. The second part of Jan's question is, why can't I just eat one meal per day to lose weight? And I think that just to build on what Jan is asking, if I might, is that when a person is diagnosed with diabetes and may have to manage their weight, they have a lot of things to balance and they're trying to simplify it. So I think it's a great question. Why can't I eat just one meal a day to lose weight?
Our bodies are within our bodies, we have a system that regulates body weight. It's physiology, it's biology, and the system that regulates food intake is called the homeostatic system. And usually we have 3 episodes a day where we get hungry, where we eat, where we start to feel full, we stop eating, and then we are fine for a couple of hours, 2 or 3 hours, then it happens again. So we have these episodes of hunger and feeling full, satiety, feeling satisfied with our food. And so that's breakfast, lunch, and dinner. And one thing that can happen if you skip meals is that you're overly hungry and you eat too fast and you do not, your body's natural signals that regulate the amount of food intake can be overcome. So, we generally want people not to be skipping meals because what they can be doing is they can be exacerbating the hunger signals and tamping down on the satiety signals. So we want people to spread their intake out, usually across the day, but we don't want them eating into the night. No, we don't want them getting up and at 9 o'clock at night and having something to eat, or even waking up in the middle of the night and having something to eat. No, I think people need to understand how the body regulates. We don't have to remind ourselves to eat. Our bodies are telling us to eat. It's telling us with these signals. The hunger hormone ghrelin, it's produced by the stomach. And it's when the ghrelin levels are high, you're hungry and you want to eat. And then after you eat, when food enters the intestine, other signals are released. Those hormones are GLP-1, GIP, CCK, and when nutrients are absorbed, the pancreas releases amylin, and that hormone goes to the brain, and those are satiety hormones. So we have this natural regulatory system, and we need to work with that.
And just to expand on that, and that's such a excellent response in terms of making sure that we're getting the proper nutritional intake during the day so that we don't want to eat more at night. And it leads me to another discussion that has to do with treatment and management of weight, which is lack of sleep. And that's something that is so under discussed. Yes, lack of sleep. So how do we, and often that's not always discussed in medical appointments because there's so many other things to talk about. How does sleep affect our weight and our health? And with somebody who's trying to manage their weight, their body weight, and lose weight and keep their lean body mass, how important is sleep?
Well, yeah, so sleep and the lack of good sleep deprivation, it it messes up the body's natural signals around appetite, around hunger and satiety. So we absolutely must have good regular sleep if we're going to have a good regular food intake habits. I think it's sometimes people are on shift work. It makes it very difficult
Yeah.
for them, especially if they're changing, if they're going from night work to day work to night work. It becomes very difficult because your body's physiology that regulates food intake is disrupted, and so it can be very difficult, and it really promotes weight gain. Any kind of stress promotes weight gain. I think we need to acknowledge that. I mean, we need to take care of our mental health.
Yes.
Financial stress can promote weight gain. We need to, we need to make sure that our bank accounts are in order.
Right.
That's another driver of weight gain. I think for people with diabetes, we know our patients with diabetes are more prone to gain weight. Often when in our weight loss studies, they lose less weight. And one of the big drivers of that inability to lose weight and the weight gain is mild hypoglycemia. So we need to be very careful about that in patients with diabetes, because mild hypoglycemia really promotes hunger.
Yes, and when you get too hungry and when your blood sugar drops, it's not the best time to make great decisions about what you're eating. For sure, that's very important. And with sleep, I always try to have the conversation about having a routine at night, and it's very hard, you're
Mhm.
right, with shift work or people who are in performance or people who are in law enforcement. Firefighters have very hours that go from night shift to day shift to night shift, just to name a few. So as best as you can have a routine at night, and to turn off the TV and other technology. And of course, it leads to issues with diabetes. Technology does not get turned off, and we understand that, but the best to have a routine will help with sleep in a lot of circumstances, for sure. And of course, nutrition and looking at all those. Another reason to speak to a registered dietitian and a diabetes care and education specialist, right? To
Yeah,
individualize
absolutely.
those kinds
And
of suggestions.
Susan, I talked a lot about hunger and satiety, but we don't just eat because we're hungry. Sometimes we eat because food is just it's going to be interesting, it's going to be delicious, it's going to make us feel better. So sometimes we eat for comfort and for excitement about the food.
Yes,
So that's another sort of pitfall that I think patients need to be aware of.
absolutely. Pam has a great question. Pam wrote in with a question which reads, why is treatment like, and she's talking about GLP-1s, she's mentioning some of the brands, not recommended as a preventative treatment for type 2 diabetes? Her question is,
Mhm.
why aren't these medications recommended across the board to prevent type 2 diabetes?
Mhm. Our Food and Drug Administration does not allow for an indication for diabetes prevention. You know, these medications, they're wonderful. They're great discoveries. They produce robust weight loss in many people. And we have there's a lot of discovery going on with new medications in the pipeline that are related to these, but they're expensive. And every medication has side effects, and there are safety issues with all medications. So I think there's always this balance about risk and benefit. And so we haven't gotten to the point with our degree of comfort in using the GLP-1 medications to use them for preventive purposes.
Mhm.
We have a new indication for people with obesity without diabetes for secondary prevention of cardiovascular disease. That's a first for an obesity medication. And I hope that as we go on, we have more evidence about the safety of these medications that we will be able to use them for preventive type care. But I think right now it's very difficult to get these medicines paid for for
Yes.
individuals who have prediabetes because we don't have an indication for it.
Very interesting. That's interesting. And
Yeah.
I know that a lot of people certainly have that question. And as our discussion
Yeah.
today is on the multiple treatment options that we've talked about, of course, starting with nutrition, physical activity, perhaps bariatric surgery in certain cases, medication, proper sleep, looking at stress levels. How do we begin these conversations with our physicians, with our healthcare providers, nurse practitioners, PAs, for example? How do we start those discussions? Because it's such a sensitive topic to speak about. Do you
Goodness,
have
yeah.
any suggestions?
Yeah, I think patients feel judged by their weight. And, it traditionally, historically, patients have been in charge of their weight loss journey. The physician, the nurse practitioner, even some dietitians haven't been sort of pulled into that. Like patients really feel responsible for their
Mm,
weight. I think that's changing. It's changing because we know how serious obesity can be in terms of health consequences, and because we are discovering more tools to use to help patients lose weight safely and successfully, and to get the health benefits of that weight loss. So I think what we teach our physicians to say is it okay if we talk about your weight? Look,
mhm.
sometimes the patients are going to say no, no, Donna. My mother was just put in the assisted living facility, and I'm her primary caregiver, and I do not have time to worry about my weight. And that's
Yeah.
fine.
Mhm.
So yeah, so I think it's a sensitive topic, but it shouldn't be. I think it's our duty as healthcare providers to raise the topic, but to be sensitive to patients. I think patients know when their healthcare providers feel comfortable talking to them about their weight. I think you can tell by what the office looks like. Does the office have chairs that accommodate larger
Such
patients?
a great point.
Is the
Great
yeah, is the
point.
reading material appropriate? So I think how are patients received by the receptionist? What is the attitude of the office staff to the patients? We know patients with obesity sometimes fear going to their doctors because they
Yes.
will be judged by their weight, and they won't be given good advice. But that's changing.
I completely agree. And I love your response on all the questions, but on particularly that one, because if somebody went in who is very sensitive about their weight with a concern to
Mhm.
their physician and they don't bring it up, and the physician or the healthcare provider, not
Mhm.
blaming anyone, but says to them, possibly with very good intentions, before
Mhm.
you come back or don't come back, which is even worse, until you lose 10 pounds, the answer for the person living with diabetes who might be battling weight is they won't come back for their follow-up appointment. That will be
Exactly.
the
Exactly.
solution
Yeah.
to that. They won't follow up with it. So it's a very sensitive topic. And what might also work is to set up perhaps a second appointment, and you can reach out perhaps through the patient portal and say, I'd like to set up a separate appointment. It could even be brief, to talk about weight management, because there are so many other things to talk about in medical appointments.
Mhm.
A specific discussion about that. So as we're moving forward with tonight's discussion, and our guest speaker, Dr. Ryan, has suggested so many different fantastic things. Please remember to schedule a visit with your healthcare provider and healthcare professional to focus on obesity management and setting realistic weight loss goals. As we spoke about tonight, it's not looking at what were they, the Metropolitan height weight charts from 1959. Those
Yeah.
may no
Yeah.
longer apply, right? Okay.
I hope
And
not.
remember those? Learn about treatment options that are available to you and ask for appropriate referrals to your registered dietitian, nutritionist, physical therapy, exercise physiologist, and of course, as Dr. Ryan pointed out, a therapist, a mental health specialist, if that would be helpful to you. And just an additional point that I will come back to in a few minutes, please continue to stay with us for the next few minutes, because at the end, we're going to have a very brief survey that we would really appreciate your feedback on. Dr. Ryan, are there any key points or any key takeaways that you would like our listeners to take away from today's discussion?
You know, Susan, I think you did such a good job of setting this up as a personalized approach. We don't have any average patients. Every patient is different. Every patient is special. What works for you may not work for your next door neighbor. You know, I think that, you know, it's especially with weight management, it's so important to find a healthcare provider that you can trust and to help you in your weight loss journey.
Absolutely. And please, when you go into a medical appointment for any reason, try to set the agenda partially yourself. So if this is something that you want to discuss, please make that known. It's extremely, extremely important. Remember to talk to your doctor and members of your healthcare team about your weight management on an obesity focused visit, and the options, all the treatment options that we talked about tonight that can be available to you. And please remember to also go to diabetes.org/obesity and register for our next events at diabetes.org/experts. Sign up for the diabetes education programs that are near you, and call 1-800-DIABETES, 1-800-342-2383, or email askada@diabetes.org to request a digital copy of How to Thrive resource that can help you on your diabetes journey. A very, very big thank you to Dr. Ryan for answering all the great questions, both from our audience tonight and from me. We really appreciate your discussion. I'm very sorry if we did not get to all the questions that you wrote in tonight and called in about during the live event. We appreciate you. We've gotten a lot of questions. So please join us for our next events. And again, you're more than welcome to contact us at askada@diabetes.org. In addition, please know that the Ask the Expert events are all available on demand at diabetes.org/experts. Thriving with Diabetes takes a team, and we are here to support you. Again, a very special thank you to Dr. Ryan. And my name is Susan Weiner. On behalf of the ADA team, we want to thank you for joining us today. And please join us for our next event, which will be held on November 12th at 2 p.m. Eastern Time. Why Everyone Needs Diabetes Self-Management Education and Support. Ask your provider for a referral. And on December 10th at 2 p.m., 8 Keys to Overall Health. Please register. Again, it's all free at diabetes.org/experts. That's diabetes.org/experts. And please visit our website for more information at diabetes.org/experts. If you have any questions about this event, please email askada@diabetes.org, and always include Ask the Experts Q&A in your subject line. Thank you so much for joining today. And now let's go into our brief survey, which I would really appreciate you all staying with. It'll take less than 5 minutes. It's 6 questions in total. Please let us know your level of agreement for the following statements. Question 1, this event met my expectations today. Question 1, this event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Again, question 1, this event met my expectations today. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. If you feel like you can use some support for managing your diabetes, please check out the diabetes.org website. There's so many links and so many resources and so much information that could help you on your journey with diabetes. That's the diabetes.org website. Let's move on to question 2. Question 2. I will attend another Ask the Expert event. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. Again, question 2. I will attend another Ask the Expert event. For yes, please press 1. For no, please press 2. And if you're unsure, please press 3. And as we showed you in today's event, anytime you want more information about obesity management, please visit diabetes.org/obesity. There are some fantastic educational tools and resources on there. That's diabetes.org/obesity. We are ready for question 3. This event improved my knowledge of obesity care treatments using not a one-size-fits-all approach. This event improved my knowledge of obesity care treatments, not a one-size-fits-all approach. For yes, press 1. For no, press 2. And if you're unsure, press 3. This event improved my knowledge of obesity care treatments, not a one-size-fits-all approach. For yes, press 1. For no, press 2. And if you're unsure, press 3. Did you know that 38 million people live with diabetes, so you are not alone? And if you're looking for peer support, check out diabetes.org/community. Diabetes.org/community for more information. Okay, only a couple of questions left to go. Let's go to question number 4. Question 4. I intend to use my knowledge I gained for my or my loved one's next appointment with a healthcare professional. Question 4. I intend to use my knowledge that I gained from my or my loved one's next appointment with a healthcare professional. For yes, press 1. For no, press 2. And if you're unsure, press 3. For yes, press 1. For no, 2. And if you're unsure, please press 3. Remember to check out knowdiabetesbyheart.org to learn more of how to take simple and practical steps to reduce your risk of heart attack, heart failure, diabetes, and kidney disease. Okay, question 5. Before this event, I felt confident talking to a healthcare professional about my or my loved one's obesity care treatments. Before this event, I felt confident talking to a healthcare professional about my or my loved one's obesity care treatments, not a one-size-fits-all approach. For yes, press 1. For no, press 2. And if you're unsure, press 3. Before this event, I felt confident to talk to a healthcare professional about my or my loved one's obesity care treatments. It's not a one-size-fits-all approach. For yes, press 1. For no, press 2. If you're unsure, press 3. There's so much to know about taking care of your health and living with diabetes, and it can be overwhelming. If you want to learn more about tools and strategies for burnout and mental health, please go to diabetes.org/health, wellness, mental health. Just search the diabetes.org website for mental health, and it will bring you to the link. And thank you for staying with us. Let's go to the last question, question 6. After this event, I feel confident talking to a healthcare professional about my and my loved one's obesity care treatment, not a one-size-fits-all approach. For yes, press 1. For no, press 2. If you're unsure, press 3. After this event, I feel confident talking to a healthcare professional about my or my loved one's obesity care treatments, not a one-size-fits-all approach. For yes, press 1. For no, press 2. And if you're unsure, please press 3. We sincerely appreciate your time and look forward to engaging with you at our next Ask the Experts event. Please remember to visit diabetes.org/experts to learn more. Thank you so much for your time.